The following is patient information designed to explain common ear, nose, and throat symptoms presented by experts in the field.
Hello, my name is Dr. Scott Schaffer, and today I would like to discuss one common but confusing type of reflux disease called laryngopharyngeal or silent reflux. LPR is unique because it irritates the throat without patients having any heartburn. I myself suffer from LPR, so I understand it both from a patient and a doctor's standpoint. Well, Katie, you came to me with a sore throat, and after hearing your story and doing a head and neck exam, I see that you suffer from LPR, or laryngopharyngeal reflux disease. I've drawn a picture of you, and this is what you look like on the inside. Here's your nose and the back of your nose, your mouth, the back of your mouth, your throat, your vocal cords, the esophagus down to the stomach. Now, stomach secretions shoot upward through the esophagus, and when they hit the back of the throat and the back of the nose, they cause redness and inflammation. The body reacts to that, and that's what gives you symptoms. So, for example, all the tiny glands, we call them minor salivary glands, become hypersecreting. And when they make extra phlegm, it drips down the back of your throat. We call that postnasal drip, and it gives your throat clearing. Certainly the inflammation itself leads to sore throat, and many patients get mouth ulcers. The side that you tend to sleep down on, so if you sleep with your left side down, you should tend to get your mouth ulcers on the left side.
But what should I take for allergies?
Well, you do have minor allergies, but most of the postnasal drip that you feel, that you think is coming from your nose, is actually that hypersecretion of the minor salivary glands. We can give you some allergy treatment, pills or sprays, but I think the biggest improvement is going to be from settling your stomach.
But why don't I get heartburn?
Well, let me explain it to you. Here I've drawn a picture. If you live next to a volcano that's quiet, you don't realize that molten lava is slowly accumulating under the surface. It's not till it erupts out through the top of the volcano that it burns everything in its path. Then it becomes a problem. And it's the same thing with LPR. Because the esophagus is protected, the small amounts of stomach secretions coming up don't burn through here. They don't cause any problems. It's not till it comes out into your mouth and throat that it causes symptoms.
I went to my GI doctor and he looked at my stomach and he said I didn't have reflux.
So what he meant was your esophagus was normal. You didn't have esophagitis. GERD, meaning gastroesophageal reflux disease, gives inflammation of the esophagus, and that's what gives you the heartburn. But with LPR, you only need 4 to 6 drops of stomach acids to come up to burn the throat. And the esophagus is insulated in 3 different ways. So when that small volume shoots through here, you don't even notice it.
Okay, why did it happen all of a sudden though?
Well, it's not actually all of a sudden, but there are several different things that cause LPR. I think it's probably a perfect storm of many different causes of LPR, and they've all happened to you at the same time. Stress is number 1 on the list.
I have been very stressed with college work and finals.
Foods, eating the wrong foods, or particularly late at night right before you go to bed.
Yeah, that sounds familiar too.
Side effects of medications. Now, I'll go over those later, but I don't think you're on anything that causes it. Stomach compression, if you've gained weight or if you do a lot of abdominal exercise.
Yeah, I've just started going to the gym a couple times a week.
Right. Patients that have lower GI disease, like ulcerative colitis or irritable bowel syndrome, it's almost like the GI system backs up, and it keeps backing up to the throat. Smoking, I know you don't smoke and you're not around smokers, but people who smoke have an increased chance of LPR. And there's usually a family history of some type of reflux.
Yeah, I think a couple of my aunts have
Okay.
reflux disease.
So I think it's a combination of these factors for you.
Is that why I always feel postnasal drip?
And yes, that postnasal drip is coming from hypersecretion of the minor salivary glands.
Why do I constantly feel a lump in my throat?
Well, the lump in the throat comes from swelling at the back of your tongue and around the bottom of your throat. If you think of the throat like a funnel, when everything's wide open, you swallow easily and you don't feel any hang-ups. But when there's swelling there, you actually have to swallow around that, and that's what gives you the sensation of a lump in the throat. That's often the last thing to go away with treatment.
Okay. What can I do?
Well, let me show you first anti-reflux strategies. That's the cornerstone of treatment. 2/3 of patients get better just by following these suggestions.
Okay. The proceeding was patient information about common ear, nose, and throat problems. This does not replace true medical care. Patients with persistent symptoms should seek the care of a qualified physician.